Morton's neuroma is once again a condition we see all the time. I guess the thing with foot issues is they tend to, one bit relates to the other, and so often we get these conditions showing up all at once or a few at a time. And talking about neuromas, let's explain what they are. They occur within the toes, and so we have nerves that run down in between, all sort of through the forefoot and then into the toes. As the nerves cross the metatarsal joints, the bones become larger through here, which means there's less space around for the nerves to travel through. When we look at the way that neuromas form, there's a traumatic component to it, and so what tends to happen is there's often movement occurring through the toes. There might be repetitive motion. Restrictive shoe wear can cause compression through those joints. Things like that which cause compression or trauma or movement of those nerves tend to be what we're looking at in terms of what leads to these neuromas. The problem with those too, with neuromas, is once they form, is it causes the nerve to actually increase in size. It swells the nerve, which is almost the worst thing we could hope for, because once the nerve swells, it actually means there's less space available between those joints. And so it sort of gets worse with time. The longer it goes on, the bigger the swelling, the more pain there is, all that sort of stuff. What tends to happen is people tend to start to limp or change the way they walk instead. But then that leads to other issues also. So resolving these things as soon as we can is extremely important. Treatment will focus on trying to increase space for this nerve. So what we need to do is take away the trauma that's being applied to it, which led to it getting inflamed or led to it swelling in the first place. It may involve using a moon boot. So one of these again is something we can use first off. But it doesn't have to be that usually. We can normally come up with a way we can use your shoe wear that you currently have, maybe look to change that in a way. We need something that has space through the toes. We can often put some padding through your shoe to allow that, to give space in between those bones to let that nerve release. There's other options as well in terms of injection therapies and things like that, which we can use. All the way down, if we're not seeing results, a referral to a surgeon can be an option also. So there's treatment options all the way along, but it's about seeing what works first and using what's most effective first up. Often they can be resolved. They do take a little bit of time, but they can be resolved with some easy interventions, especially early on.